Hi, welcome back to NP Nerd. So in this video, I want to talk about my favorite textbook in wound care, which is The Acute and Chronic Wounds by Bryant and Nix. I hope you guys can see it opposite, I guess. Okay, I'll put the link in the description section. But this is the 5th edition. The latest edition is the 6th edition right now. It's out. And this book I love so much. It has very good pictures. It has a section in the middle between page 116 all the way up to page, I believe, I don't know, about like 120 or so, is all different pictures, different plates, pictures, very nice visuals, and it's very easy to read. It's not boring, and also it is divided by really good, it has a good sections, you know, the whoever did the table of contents knew what they were doing. So I started reading section 2. Section 2 was pressure ulcers. So they talk about pressure ulcers, how does it develop, and then how to prevent it, and support surfaces. And then after that, in section 3, they talk about lower extremity wounds, which includes arterial ulcers, venous ulcers, and lymphedema, as well as diabetic wounds as well. And they also includes the nails and foot care. So all of that is under one section. It has it has 6 chapters, section 3. And then section 4 has 3 chapters. It's called wound bed preparation. And the first chapter there is about infection and how do you manage infection. And then it's about debridement, wound debridement. And the third one is about principle of wound healing and topical management. So these, what I just said right now, section 2, 3, and 4, if you can read these and really understand them very well, you probably will pass your CWS exam, and you'll know what you're doing. You'll really know a lot. Now, if you want to add more information and you want to have more advanced knowledge about wound care, then you can read through section 5, because this one is about grafts. It's about cellular regulators, wound vacs, HBO, electric stimulation. So this is more advanced stuff. And then we have the next section is about pain, controlling pain, and it's about nutritional assessment. But also there's a section there that's called perfusion and oxygenation. It's such an informative chapter. I love it so much. It teaches you how to spot arterial disease in the legs and how do you diagnose it, how do you treat it. Well, I mean, we're not vascular doctors, but you have to catch that. We're the ones who's going to catch these things and catch the signs of these things. And it shows you how to read your ABIs. What does your ABI mean? How do your Dopplers will look like? When do you order Dopplers? Very important. And then the section after that is about atypical wounds, such as burns and surgical wounds. And then at the very end, it talks about palliative care, how to manage fistulas, drainage, and pediatric patients. And then back to the very first chapter, what I like about the first chapter is that it's talking about the physiology of wound care. So it ties it all together. So that way you know what you're looking at. When you're looking at a wound, you can describe it very well. It shows you the different kinds and types of skin damages and differential diagnosis that you can use, and how do you perform a wound assessment. So I love the table of contents. I love the pictures. And also at the end of every chapter, well, not only at the end of the chapter, also throughout the chapter, they include a lot of case studies. So that way you know how to apply what you just read. So it's not just reading, it's a lot of application. It has really nice tables. It highlights the important things in bolded, words when it's something important. And then the tables are very nice because they kind of tie it all together, and they make it more easy to memorize, I think, easy to navigate. But yeah, that's really the book that I really like. Let's see, the other book I want to show you is a little bit older book, but I love it a lot. It is this one. I'll put the link also. It's called Wound Care Essentials Practice Principles. So my preceptor, my teacher told me about this book, so I went and bought it. So this one does not have as much visuals as the first book, but it has a ton of information about billing. If you want to learn about billing in wound care, I love the chapter there about that. It talks a lot about low air loss mattresses. How do you bill them? When do you order them? And it does have a good section about like all the treatment options that you can use in wound care. So it's a little bit less comprehensive than the first book. And it does have a lot of, it does have a section here in the middle that has a lot of pictures, but this is the only really area that has pictures. The rest of the book is mostly tables and black and white pictures. So I do love a lot of things about this book, especially also debridement. It was talking about, the section about debridement is very important. A lot of my patients will ask me, why are you numbing my wound? What is debridement? When you tell them you're going to debride, a lot of our patients you'll have to explain to them what debridement is. So you got to tell them what you're doing. And this is very easy to read, very, very informative book. And last but not least, especially if you do dermatology in addition to wound care, I love this book a lot. This is a thick book, by the way. It looks small, but it's not. It's a big book. And it is Clinical Dermatology by Savidra, Rowe, and Makalov. And I'm going to send this, I'm going to put the link also in the description. And it's by Fitzpatrick, by the way, if you're familiar with this right here. So what I love about this, first of all, it's very, very comprehensive. So if you really want to get into dermatology, this is your book, you know. I love dermatology, but I do love wounds more. I see more wound patients than dermatology patients, but I still love this book so much. Wealth of knowledge, especially it's mostly pictures. It's really mostly pictures. And so it's like an atlas, really, of pictures. So when you see things in this book and then you see it in real life, you can kind of say, oh, you know what? I saw this in the book. I think I know what this is. And then you can come back and confirm. Very, very good book. And it's heavy too. I think it's just the thickness of it, you know, even on the outside, the pictures are so interesting. But yeah, these are my 3 favorite books. And mostly these 2 are really the books I used when I created my wound course. These 2, because my course is not about dermatology, it's just wound, but I do have a dermatology course coming up. So then I'll be relying on this one a lot. And that's about it. Happy studying.